On live now from Fox with the announcement of Kate Middleton. Says she has cancer at the age of 42 years old. King Charles saying in a statement, proud of Catherine for her courage. Again, we are going to be continuing to showcase this and really talk about the major news story of the day on live now from Fox. And again, we appreciate all our viewers continuing to be here as well during this very, very big moment on live now from Fox. I do want to bring in our next guest here of this hour.
I'm Sumit Rai, the CEO and founder of Cancer Check Labs, an early detection cancer screening blood test. And so, just heard about the Kate news and versus Kate. Very sad. It's very difficult to know exactly what she has at the moment. Obviously, we know that she had stomach surgery earlier, and we're hoping that it's not a gastric cancer that's spreading. It is good that they started chemo and they're getting there somewhat early, hopefully, and they've been on top of it. The key to curing cancer generally is early detection. So it really comes down to when they've found it, at what stage, how early versus how late. That's truly what's going to impact the probability of her survival.
Yeah, that is so true. Where early detection always key for this moment. And when we first heard that Kate Middleton was going to the hospital, that was back in January, and she stayed in the hospital for 13 days. Is that the type of situation where when someone is going that a doctor may see something that in a checkup they don't expect? And is that how a lot of these things are uncovered?
Oftentimes, unfortunately, yes. When typically when that happens, there's symptoms. So she was probably experiencing some form of symptoms from the disease. She went in to get checked. They found something that they probably felt needed acute and immediate attention. And as a result, they likely admitted her, did the procedure, and kept her there for weeks. With regular screening, if you kind of go in for a mammogram or if you go for a blood test like ours or whatever the case might be, they'll usually detect something. They'll do more, downstream workups, more imaging, more blood work, and you'll come in over a period of time. So the fact that she went in probably was symptomatic, which is what caused her to likely go in, and then stayed there, was admitted, and went into an immediate procedure, likely means that there's probably some advancement and something of concern that needed to be addressed immediately. Now they're obviously seeing that whatever they did at that time may have been insufficient, which is why she's going through chemo. She needs further treatment to try to eradicate the cancer in its entirety.
And of course, this is happening to someone that is in the public eye. Millions and millions of people follow her story, and the royal family is such a big moment for so many people. Do you think with this announcement that she had the courage to put this video out, what do you think this will do for other women in hopes of trying to get preventative screenings?
I think it will help them. And I think that's her goal with putting this out is so, having personally lost my sister, which is what drove me to start this early screening cancer detection company, you never want to see anyone that you love, friends, family, go through something like this. And I think once you've been experienced or had touched cancers in your life and you've had to deal with that with yourself personally, with someone you love, with a parent, a sibling, a child, you become very sensitive to it. And I think because she's going through it, she's also become very sensitive to other people going through a similar plight. So I think her goal in putting forth that video was to encourage people to get more early screening, detect it early, be able to address it so that they're not at a stage where, unfortunately, they walk into a hospital, they have to be admitted, go into stomach surgery, follow up with rounds of chemo. You want to try to minimize as much of that as possible with early detection.
And thank you for sharing the story of your family member and giving you the inspiration and hope to try to save many other women in this battle with cancer that affects millions of people, where it's a story that has common threads, and it doesn't matter if you're poor, middle class, or a royal family member, it impacts so many people.
Yes, it does. It's unfortunate that cancer is so indiscriminate. It hits all socioeconomic classes. It hits all ethnicities. It hits everyone of all ages. You know, you have pediatric cancers, then you have people that are elderly that develop tumors and leukemias and blood cancers. It is something that's truly indiscriminate. And you know, last year alone, there were over 10 million recorded deaths in cancer. And there will be more unrecorded, obviously, than what we recorded. So even at that rate, if you were to just look at the number of lives that will be lost to cancer over the next 100 years, just one short century, you know, 10 million lives per year, 100 years is 1 billion lives. That exceeds the most common estimates of total casualties of all wars in known human history. The best historians estimate that to be 350 to 400 million people. So cancer is something that is definitely attacking humanity and certainly needs to be addressed, ideally starting with early detection.
Well, Sumit Rai, thank you so much for coming on here on Live Now from Fox, giving us some great insight on this really tragic disease. And we hope for the very best. And we thank you and your team for doing all that you do.
Thank you so much. I appreciate you having me very much.